It's January 2026. A reporter is sitting at a kebab shack in Schaffhausen, Switzerland, and two Swiss police officers walk up to him. They were called by executives next door, at a company called Ascent Health Services. The reporter wasn't trespassing. He wasn't yelling. He was just looking at their building. Because Ascent, on paper, is a ghost. No public phone number, no direct email. A handful of employees on a single floor of a building shared with letterbox shell companies. And yet this ghost moves $750 billion in healthcare purchasing. That's roughly the GDP of Switzerland itself, flowing through one quiet floor on Mühlentalstrasse 36. This is the story of how that ghost company quietly inflated the price of your prescriptions, especially insulin, for years, and how, on February 4th, 2026, the FTC finally blew it open. To understand it, you have to meet the middlemen, pharmacy benefit managers, or PBMs. Three companies, Express Scripts, CVS Caremark, and OptumRx, control roughly 80% of all U.S. prescription drug volume. They manage benefits for more than 240 million Americans. PBMs decide which drugs your insurance will actually cover. That list is called a formulary. To get on it, drug manufacturers pay the PBMs enormous kickbacks. Officially, they're called rebates. Now, normally, paying kickbacks in healthcare is a federal felony. The Anti-Kickback Statute makes it a crime. But in 1991, the Department of Health and Human Services carved out a loophole, the discount safe harbor. 42 C.F.R. section 1001.952H. It explicitly protected manufacturer rebates to PBMs from prosecution. And that one paragraph reshaped American drug pricing. Because here's what PBMs realized. The bigger the list price of a drug, the bigger the rebate check. Between 1999 and 2017, the list price of Humalog insulin rose more than 1,200%. A cheaper $50 generic gets locked out. The $300 brand name drug, with a $150 rebate, gets the preferred slot. The PBM pockets the rebate. You pay co-insurance on the inflated $300 sticker. Then, in 2019, regulators came for the loophole. The Trump administration's HHS Office of Inspector General proposed killing the safe harbor for Medicare Part D rebates. The kickback machine was about to become criminal, so the PBMs pivoted. Brilliantly, they found a different safe harbor, 42 C.F.R. section 1001.952J. This one protects administrative fees paid to something called a group purchasing organization, a GPO, which is a middleman that negotiates bulk contracts on behalf of buyers. If you couldn't call it a rebate anymore, just call it a GPO fee. Same money, different label, legal. Within months, the big three spun up captive GPOs. CVS Caremark built Zinc in Minnesota. OptumRx built MSR in Dublin, Ireland. And Express Scripts, they went further. They incorporated Ascent in Delaware in April 2019 and parked its headquarters in Schaffhausen, Switzerland. Why Switzerland? Three reasons. 1. It put the contracts beyond the audit rights of U.S. employers and unions. 2. It parked profits in one of the world's lowest tax jurisdictions. 3. It pushed the whole operation outside U.S. transparency law. Here's how the money actually moved. A drug company sets a list price on a pack of insulin at $300. Ascent negotiates a 60% discount, $180 off. But Ascent splits that $180. About $30 gets labeled a rebate and passed back to the U.S. employer, satisfying the contract. The other $150? Reclassified as a GPO administrative fee, wired straight to Schaffhausen. That $150 doesn't go back to your employer. It becomes pure offshore profit for Cigna. And the patient with 20% coinsurance? They pay $60, calculated on the inflated $300 list price. The drug's true net cost was $120. The patient just paid half the actual cost. Cigna kept $150 in Switzerland, untaxed. The man who helped architect this said the quiet part out loud. Dr. Steve Miller, former chief medical officer at Cigna and Express Scripts. According to the federal RICO complaint, Miller admitted Ascent let them double, triple dip on fees without clients ever knowing. And he was blunt about location. There are tax advantages. We were in Schaffhausen. On January 6, 2026, Hunterbrook Media published the exposé that lit the fuse. Their reporters visited Zinc's Minnesota address. Empty. They visited MSR in Dublin. Empty. And when they tried to observe Ascent's Schaffhausen office from a kebab shack next door, the executives called the police. A former Ascent employee told Hunterbrook the operation looked, quote, like shifting money. They move money here and there. 4 weeks after that report, the FTC dropped its hammer. On February 4, 2026, Chairman Andrew Ferguson announced a landmark settlement with Express Scripts. Express Scripts agreed to delink PBM compensation from drug list prices, to pass point-of-sale rebates directly to patients, and, critically, to reshore Ascent from Switzerland back to the United States by July 1, 2028. $750 billion in purchasing activity coming home. The FTC estimates up to $7 billion in patient savings on drugs like insulin over the next decade. The next day, February 5th, the White House launched trumprx.gov, a direct-to-consumer site for cash-pay drug prices, with Express Scripts agreeing to list its standard offerings. By May, TrumpRx had expanded to over 600 generic medications, integrated with Amazon Pharmacy, GoodRx, and Mark Cuban's Cost Plus Drugs. Then came the lawsuit. On February 17, 2026, the Plumbers Welfare Fund, Local 130, a Chicago union health fund, filed a federal RICO class action against Express Scripts and Cigna. Case number 126-CV-01718, Northern District of Illinois. The complaint alleges Express Scripts used its negotiating power to divert exorbitant fees to Ascent, fees that, quote, traditionally would have been considered rebates and passed on to Express Scripts PBM customers. Their 2019 contract had required Express Scripts to pass back 100% of rebates. The Swiss reclassification let Cigna keep them anyway. 2 weeks earlier, on February 3rd, President Trump had signed the Consolidated Appropriations Act of 2026, the first major Medicare Part D PBM reforms in nearly 20 years. By March 24, CVS Caremark folded too. A proposed FTC settlement mirroring the Express Scripts deal. Optum Rx is still negotiating. Independent pharmacists were the first to celebrate. B. Douglas Hoey, CEO of the National Community Pharmacists Association, said the settlement, quote, obliterates the big PBM industry fiction that they work to lower the cost of drugs. So step back. For decades, you paid more for insulin so a Swiss shell company could pocket reclassified kickbacks. Patients rationed insulin. Some died. Independent pharmacies closed. In December 2024, over 200 school districts sued PBMs and drug makers for fraud and insulin price fixing. Under the new CAA, PBMs must now provide drug-level pricing transparency and submit to annual audits. By July 2028, the lights at Mühlentalstrasse 36 will go dark. About 100 jobs gone from Schaffhausen. But the real picture is this. The most powerful trick in American healthcare wasn't a price, it was a label. Change one word, move one office across an ocean, keep the money. The ledger was hidden in plain sight, in a town famous for making watches.